Hi, everyone. Welcome to Diabetes Primetime, the show where diabetes experts answer your questions. I'm really excited because we have an awesome giveaway and an awesome guest for you tonight. Our dietitian, Melinda, has put together a healthy chocolate guide with 3 delicious recipes and some great information about the health benefits of chocolate. And everyone who answers the trivia question is get that for free. So be sure to stay tuned for that question. And tonight our theme is Ask an Endocrinologist, and we are super fortunate to have Endocrinologist Dr. Yasmin Khan joining us. Dr. Khan, thanks so much for being here with us.
Thank you. It's great to be here.
So February is National Heart Health Month. So let's start by talking a little bit about the connections between diabetes and heart health. Why is it so important for people with type 2 to take care of their heart?
Well, first of all, diabetes is a major risk factor for heart disease. So patients with diabetes have an increased risk. In fact, they have 2 to 4 times increased risk of heart disease. So if you do have diabetes, this is a very important conversation to have with your doctor to assess what is your risk for heart disease.
Oh, I think that's so important to know. And I know the ADA often talks about kind of the ABCs of diabetes. What are those numbers that every person with diabetes should be aware of?
So the ABCs are steps that we can take to manage the diabetes. So the A is for A1C. The A1C is the gold standard test that we use for diabetes. It gives you the average blood glucose over a 2 to 3 month period.
I will say real quick, anyone who watched our trivia, got our trivia question a couple of episodes ago, knows what their A1C stands for. So sorry, please go ahead.
Problem. It's a very important test, and actually for people when they're first diagnosed with diabetes, we recommend an A1C at the time of diagnosis, and then oftentimes we will continue to check the A1C throughout the year, every 3 to 4 months. So this is probably the most important test we use to manage a patient with diabetes. And then the B is for blood pressure. So blood pressure, I tell my patients it's just as important as getting your glucose under good control as getting your blood pressure under control.
Absolutely.
Blood pressure is a very important risk factor for heart disease, and it's a measure of how hard the heart has to work. So the higher the blood pressure, the more stress the heart is under. So that's why it's so important to get the blood pressure in a good range. And then the C is for cholesterol. So, you want to make sure that you're checking the LDL. The LDL is considered to be the bad cholesterol, so you want that on a low level.
Mm-hmm.
And HDL is the healthy cholesterol, so you want that as high as possible.
So if I was a person with type 2, what are the general numbers I should be looking at for those ABCs? And as always, just a quick note, we just provide information. You will definitely want to talk to your doctor about what your specific targets are. But just in general, as a general guideline, what should people be looking for with those ABC numbers?
So for the A1C in general, we recommend an A1C of 7% or less. And we know that the higher the A1C, the greater the risk is for complications of diabetes, including heart disease. So I tell most of my patients 7% is a good target. In some patients, we prefer a slightly higher target. In some patients, a slightly lower target. But 7 is a really good number to work with.
Mm-hmm.
Blood pressure, I recommend a systolic blood pressure less than 140, that's the top number, and a diastolic less than 90, that's the bottom number. And again, in some patients, we are more aggressive with our targets, and in some patients, we are a little more relaxed with our target. 140 over 90 is a good number to look at.
Mm-hmm.
And for cholesterol, I prefer to keep the LDL, which is the bad cholesterol, less than 100. And I review all of these parameters with my patients almost at every visit. So make sure, sometimes the whole visit can go by and you're talking about glucose levels, but make sure you're also addressing your blood pressure and also your cholesterol levels with your doctor.
I think that's such a good point because, I do think sometimes when we think about diabetes, we focus really myopically on that A1C number. But as you said, heart disease is a real concern for people with diabetes. So it's really important, to be looking and talking with your doctor about the blood pressure and cholesterol as well. So if someone has a family history of heart disease, is there something different that you might recommend that they do or talk with their doctor about?
Well, if you have a family history of heart disease, I recommend just being a little more aggressive and maybe getting screened a little earlier. So some medications we may start a little earlier on if you have a family history. So especially, for example, with cholesterol, typically we might wait to start a medication like a statin, but if you have a family or family history of early heart attack, then that's something that we might start earlier. Same thing, with blood pressure and A1C. We get more aggressive if you have a family history. And also, there are a new class of medications now that are available for diabetes that not only work on the glucose levels, but also can be heart protective. And we'll talk a little bit more about that later on. But we have some really good options now for diabetes medication that also can protect your heart. If you have a family history, that's also a good path to take.
Excellent. All right. Well, I want to say hello to several people. Hello to Sharon from Massachusetts, to Sally from Wisconsin, to Emma from Albert, Terry from Chicago, and Lisa from Wisconsin. Hello to all of you. We're so glad you're here with us. We're so fortunate to get to talk with an endocrinologist who's going to be answering your questions. So please tell us in the comments who you are, where you're watching from, and if you have a question for Dr. Khan, we will try to get to as many of them as we possibly can tonight. Dr. Khan, I want to come back to that question of medications that can be heart protective. But before we talk about medications, let's talk a little bit about what are some things that people can do, just things in general, to be aware of that can lower those ABC numbers? What in general has been shown in studies to be effective for that?
Well, the main thing is to treat diabetes holistically. So a lot of times patients and even physicians too focus so much on medication, but actually the best treatment is a combination of medication plus nutrition plus physical activity. We can call it diet, but I tend not to use the word diet because diet makes you think of something you might do for a few weeks or a few months, and then you're no longer doing it. So I think healthy eating and nutrition is just as important as medication. Really, to lower your A1C and to get the glucose under in a good range, you want to have a very comprehensive approach that includes medications, healthy eating, and also physical activity.
I think that's so important, and I'm so glad we talked about it. And we'll come back and talk about medications in a little bit. But Sharon asks a really good question. She says, does having diabetes hide the symptom of heart disease? And I also want to say hello to Paula from Pennsylvania. So glad you're here to join us. So what would you say to Sharon about that?
Well, Sharon, that's a very good question. And this is a question that comes up a lot. So, many patients, even if they don't have diabetes, they don't always have symptoms with heart disease. So that's the first thing to keep in mind. But with diabetes, you can have what's called a silent heart disease. And so you may not have the classic symptoms of chest pain or trouble breathing or difficulty walking up a flight of stairs. Those are sort of the classic symptoms that we associate with heart disease. So, that's why, again, it's just so important to look at all of your risk factors, whether it's the A1C, the blood pressure, and the cholesterol. I have had patients in my experience who just had some symptoms of indigestion. They didn't really have pain or left-sided chest pain or shortness of breath. They just didn't feel well, and then ended up, being evaluated for heart disease, and they did have heart disease. So I think when you have diabetes, we're always on high alert. So any symptoms that you're having, if you're not feeling well and you have diabetes, it's good to just get that checked out and evaluated by your doctor. So yes, you can have silent heart disease with diabetes.
Well, I think that you make such a good point. So much of what happens with diabetes can be asymptomatic. You don't feel bad. And so that's why, we really rely on those numbers. And so keeping track of those numbers with your doctor is really the key. I want to say hello to Lori from Pennsylvania. Autumn asks a really good question. She says, can diabetes, even when it's under control, cause heart rate issues? So a slightly different version of a heart question.
So, heart rate, I would say, not as much. So sometimes if the heart rate is elevated, it could be the sign of a sick heart, or if the heart rate is slow, that could be the sign of a sick heart. Diabetes really can cause any kind of heart disease. So, getting an EKG, if you are experiencing any problems with heart rate, an EKG might be a good first step, or even an ultrasound of the heart, like an echocardiogram. So yes, pretty much you can see any kind of heart condition with diabetes.
That's a great answer. And I know that's something that has been of concern to Autumn. So Autumn, I hope that's helpful to you. We are going to take a quick break here and do our trivia question. And again, if you leave us a comment with the answer to this question, you will get our delicious, healthy chocolate guide for free. So be sure to leave an answer for us. The trivia question this week is, according to the American Heart Association, how many gallons of blood does your heart pump every day? Is it A, 1,000 gallons, B, 2,000 gallons, or C, 4,000 gallons? So again, according to the American Heart Association, how many gallons of blood does your heart pump every day? 1,000 gallons, 2,000 gallons, or 4,000 gallons? Leave us an answer. Leave us a comment with what you think the answer is, and regardless of whether it's right or not, we will be sending you that healthy chocolate guide for free. And I'd also like to send a big thank you to the two sponsors of tonight's episode. Arkwright has been working for over 50 years to make the lives of people with diabetes simpler and easier. Their blood glucose monitoring products and personalized approach to diabetes management helps empower people to live richer and healthier lives. And Amazon's choice brand of blood glucose monitors and blood pressure monitoring products make healthcare more affordable. We'll put a link to both of these amazing brands in the comments, so be sure to check them out. They make our show possible, and we are very grateful. So we've talked about the things that can lower our blood pressure, our numbers like blood pressure and cholesterol. And I know there are a lot of people who feel like they really want to do the lifestyle things. They really want to try to avoid medication. But we do have some really affordable and wonderful medications for each of these conditions. Talk me through what's available for blood pressure and cholesterol from a medication perspective.
Sure. So for blood pressure, there are really two main classes of medications that we use very frequently. One class would be the ACE inhibitors. So these are medicines you may have heard of, like lisinopril. And then we also have the ARB medications. These are medicines like losartan, for example. And these are wonderful medicines. They work very well. Not only do they help manage the blood pressure, but they can also protect the kidneys. So it's important to know that when you have high blood glucose levels, you can do slow damage to the kidney, cumulatively over a long period of time. So just by being on these medications, you can really protect the kidneys. And almost all of my patients with diabetes are on these kinds of medications. Even if their blood pressure is mildly elevated, you can still benefit from the ACE inhibitors.
I'm sorry, Dr. Khan, I just want to interrupt you. You said something that I really want to underscore. So that type of blood pressure medication, not only does it help with blood pressure, it's also protective for your kidneys. And I know that's something that a lot of people with diabetes are concerned about. So that's almost like an added benefit then.
Yes, that's right. And, kidney disease is also asymptomatic. So you don't have any symptoms. You may not even be aware that you have it. And when you do your testing with your primary care doctor or your endocrinologist, they will usually do a urine test and a blood test for the kidneys. So just part of the routine evaluation that we do for patients with diabetes. So, your doctor is always looking to see how he or she can prevent those complications. So it's not just about lowering the glucose, it's also about helping you long-term so that you don't develop kidney disease and you don't develop heart disease. And then you asked also about cholesterol medicine. So the main class of cholesterol medicine we use are the statins, and these are very effective medicines. They've been very well researched over the years, and they give a lot of benefit. They can protect from heart attack and stroke. And we have the majority of our patients are on statins, and you can discuss with your primary doctor or your endocrinologist about what's the appropriate dose for you. But these medicines are well tolerated, and they work really well, and they definitely have the benefit for the heart.
That's wonderful. We actually have a couple of questions. We're talking about the heart today, but we're really talking about everything as it relates to diabetes. And I have a couple of questions from people from Reginald and Evia. They want to know what the best way to lower your A1C is. So what would you say to Reginald or Evia?
Well, it depends on, first of all, what the A1C level is. So, for example,
good point.
if the level is very high, for example, above 10%, then oftentimes we are going with insulin as a first choice. It doesn't mean that, that there's anything wrong with going with insulin first. In fact, sometimes insulin has a very negative connotation when in fact it's an excellent medicine. So if your A1C is very high, we often will start with insulin, and we still may add some oral medications as well in the mix. But insulin is one of the best treatments if your A1C is high to bring the glucose levels down efficiently. If your A1C is, let's say, mildly elevated between 7 and 8 or 7 and 8.5, then oftentimes we can try the oral medications. But with all of the medications, whether it's the oral medications or the insulin, we also have to focus on, healthy eating and physical activity. That's always a treatment. So don't underestimate the treatment of healthy eating and also getting more physically active.
Oh, that's a great point. Karen asks, she says, is it good to take a supplement of caltrate, fish oil, and a multivitamin every day? And again, this is just general guidelines, so you'll always want to talk to your doctor. But what would you say to a patient who came to you asking you about those supplements? Do you think that's a good idea?
In general, in my practice, I don't recommend too many supplements because I think there's not always good evidence for supplements. Now, calcium and vitamin D, those are great supplements, especially for women. You do lose bone mass. And so taking calcium and vitamin D is a great choice, especially if you're not getting much calcium in your diet, if you're not getting a lot of sunlight. And let's face it, most people are not getting enough sunlight.
It's February.
So calcium and vitamin D, are supplements that I recommend. Fish oil, I don't recommend as much, but it can lower the triglycerides. So there are some benefits of fish oil as well. But I think that, overall, it's hard to take a lot of medication and it's hard to take a lot of pills. So I try to keep the supplements to the minimum for my own patients because I'm trying to get them just to take the pills that I'm prescribing.
Well, and that's actually a great point. I think often, we sometimes get sidetracked. I mean, I know I'm always looking at supplements and what should I be taking, what should I not? And it's easy to ignore the stuff that our doctor has prescribed when really that's the important stuff to be taking. So I think that's a wonderful reminder. I want to take a quick break and talk about one of the other things that people with diabetes should do every year is get an eye exam. So we're actually going to play a video now of endocrinologist Dr. Richard Jackson talking about why getting an eye exam every year is so important. So we'll play that video and then we'll come back and chat more with Dr. Khan.
I think eye exams are one of the most unappreciated areas of diabetes. When you look into someone's eye, the eye doctor, the ophthalmologist, can directly see the blood vessels in the back of the eye. In fact, this is the only place in the body where that's possible. If cardiologists could do that, probably no one would have a heart attack. When you have your yearly eye exam, the doctor is able to look very closely at the back of your eye, at the area called the retina. And before people develop visual problems from diabetes, in fact, years before they develop visual problems, there's very early changes they can see in the back of your eye that you can't appreciate, that don't affect your vision. The only way to discover these is by having an eye doctor look at your eye. The other really good news is not only can they see these early changes, but that we already have very, very effective treatments for them. So that in today's world, if someone has a regular eye exam, even if their blood pressure, their LDL, their A1C are not where they want them to be, their chances of having eye problems almost go to zero.
I do think it's amazing that getting an eye exam every year can reduce your risk of eye problems so much. So Dr. Khan, what else should people with type 2, we talked a little bit about preventing kidney problems through ACE inhibitors. What else should people with type 2 know about preventing complications of diabetes?
Well, the main thing to know is that the A1C correlates with, the risk of complications. So if you're keeping your A1C close to 7%, you're actually protecting yourself from not only heart disease and kidney disease, but also the other complications such as neuropathy, which is damage to the nerves that can happen with diabetes, and retinopathy, which is when the retina gets damaged in the eye. All of these things can really be avoided. Diabetes is a very, very treatable condition. And, there's a lot of negativity that comes with the diagnosis of diabetes, unfortunately. And when I see patients who have their blood glucose, in a good range, sometimes they're healthier with diabetes than before they had diabetes because they might be taking medication, but they're also eating well and staying physically active. So, the main thing to know is that if you want to prevent these complications of diabetes, you can feel empowered to do that. So that's the main thing to know.
I think that's so important. We actually had a few questions from folks in our Facebook group when they heard that we were going to speak with you. So I want to jump into those now. Nancy asked, and I think this is such a good question, is having prediabetes with an A1C of 5.7 for a long period just as bad as diabetes as far as complications? What would you say to Nancy?
So Nancy, I'm glad you asked this question because this is a very important question. Prediabetes, you can think of it as a warning sign. And yes, when you have prediabetes, there is a risk of developing type 2 diabetes later on. What I would say is that if the A1C is above 7, then the risk is higher of developing complications. But if you have an A1C that's less than 7, that does not mean that your risk is 0. So yes, there is still a small risk of developing these complications, even with prediabetes. In fact, studies have shown that you can still have a risk of heart disease and in some cases a risk of kidney disease. And so I really tell my patients, if I see them and they have prediabetes, I want them to seize that opportunity. It's almost like a golden opportunity because that's the best time to capture it. If you really focus on, healthy eating and staying physically active, and even perhaps taking a medication like metformin, which works really well for prediabetes, you can make a major impact, and perhaps you never develop diabetes, or perhaps you delay the onset of diabetes by many, many years, and you delay your risk of complications by many, many years, or prevent it altogether. So yes, to answer your question, there is still a small risk even with prediabetes, and I think we should take prediabetes very seriously because that's your best opportunity, actually, to prevent diabetes going forward.
Oh, I think that's such a great answer. So you brought up metformin, and I know almost every physician I talk to says they wish every person with prediabetes took metformin. Do you agree with that?
I have many patients with prediabetes who are just able to take care of it without medication. And I think that's great too, because I think some patients feel really wonderful when they're able to manage their diabetes without medication. So many times I see patients and the main focus is, how can I get off the medication? How can I not take any medication? So I think in some patients, you don't need to give metformin if they have prediabetes. But, on the other hand, many patients with prediabetes, despite their best efforts, they're just not able to really get the weight down or get those morning glucose levels down.
Mm-hmm.
Great option. So I think with prediabetes, you can really go either way. You can go with just the diet and physical activity, or you can go ahead with the metformin. I personally think that, taking a medication is good, but it's always better to have the right foundation, which is the healthy eating and the physical activity. Because then when you add the medication, you already have the foundation for diabetes management. Sometimes in our culture, we focus so much on taking pills as if that's the solution. And it is only part of the solution, as I've said.
I'm so glad you said that. And I know one of my favorite people in our Facebook group, Cindy, she talks about, the medication is important, but you have to do your job to support the medication by how you're taking care of yourself. And I think that's such a wonderful way to look at it. We help the medication do its best job by the work we do in terms of eating healthy and exercising.
Yes, that's correct.
So Shelia asked a question. She says, I can't tolerate metformin. What else can I take? And I know that's something that is an issue for some people. So what would you say to Shelia?
So Shelia, we come across this very often in our practice. First of all, I would like to say metformin is a fantastic medication. It's still one of the first line medications that we use for diabetes, but some patients just can't tolerate it. And usually what I recommend is that you could stop it for a few days and just try the absolute smallest dose, such as 1 tablet of 500 milligrams daily. So one way around that is just to go with a very, very low dose, because you still get benefit even with low dose metformin. So you could start with 1 tablet a day. Also, if you take it with your largest meal, you tend to have less side effects with metformin. So that's one way.
That's a great suggestion.
The other thing is that metformin also comes in an extended release formula. So for patients who can't tolerate metformin, a lot of times they do great on the extended release formula. So I prescribe that very often, and that works really well. And in some cases, despite all these maneuvers, the patient cannot tolerate metformin. So in that case, there are many other options. We have other oral medications, even injections now that are available that are not insulin. Two of the newer medications that I like and use frequently, empagliflozin, which also protects you from heart disease, and that's an oral medication, and also dulaglutide, which is a weekly injection. But that can not only help with weight loss and your diabetes, but it can also protect your heart as well. So these are some of the medications you could use if the metformin is not an option for you. And, of course, insulin is always an option too. So I said it before, but insulin is a wonderful way to treat diabetes. And I think that many people feel that insulin is only your last resort, or if you can't tolerate anything else or nothing else works, then you go with insulin. But that's not true. Insulin is a wonderful treatment for diabetes. We actually use it very early on, and we use it in advanced cases of diabetes too. So keep that in mind as an option too.
I'm so glad you said that about insulin, because I do think it can get a bad rap sometimes. So Nick asks, do you recommend that people with type 2 take a statin as a regular course of action, even if their weight and cholesterol are in an optimal range? A great question, Nick.
Yes, I do. So even if, your levels, your blood pressure is fine or your cholesterol level is fine, remember that diabetes is an independent risk factor for heart disease. So just the fact that you have diabetes puts you at risk for heart disease. So the statins are very good for lowering the LDL cholesterol. And, when you have cholesterol, or when you have diabetes, you can have a fatty deposit that occurs in the arteries of the heart. And so the statins are really good at stabilizing those fatty deposits so that they don't break off, and that can lead to heart disease or heart attack or even stroke. So the answer is yes, especially for patients who are over the age of 40. I would recommend a statin because that can improve your cholesterol levels and lower your risk of heart disease as well.
So we actually have a whole bunch of questions from our audience. I think they're just loving this opportunity to get to ask you questions, Dr. Khan. So Terry Duncan says, what are your suggestions for treatment for peripheral neuropathy that occurred before diagnosis? I know neuropathy is a question that a lot of folks have questions about. So what would you say to Terry?
Neuropathy, in our practice, we have specialist who treats diabetic neuropathy. So now there are many treatment options that are available. I do use gabapentin as one of the first line medications because it's not expensive and it's effective. So that's certainly something that you can look into. But if you have neuropathy at the time of diagnosis, it could be from diabetes. That's certainly the case. Typically, we see that these complications like neuropathy occur after about 5 to 10 years of having uncontrolled diabetes, but that's not always the case. In some cases, we see neuropathy as the presenting symptom for diabetes. But when I do see that, I usually will refer to the neurologist just to make sure there's not something else going on. Sometimes we assume something is diabetic neuropathy, but in fact, it could be a pinched nerve or pressure on the nerve, or it could be neuropathy from something else too. So while diabetic neuropathy is common, I would suggest, even getting an evaluation from a neurologist to make sure that there's not another cause of the neuropathy.
Oh, I think that's a great suggestion, and I hope all those folks who've had questions about neuropathy in the past, great suggestions from Dr. Khan. So Autumn says, and this is back to a metformin question. She says, I've been off meds for almost 2 years, and my last A1C was 5. Would you recommend metformin if Autumn were your patient?
An A1C of 5 is fantastic.
Congratulations, Autumn.
If I was seeing you in the practice, I would be thrilled to see that kind of A1C. And I probably would say hold off on the medication for now, and the main thing is once you get the A1C to a good range, then it's challenging to keep it there. So, the first challenge is to get the A1C in a good range. The second challenge is to keep it there. And for that, you need some discipline, support, and just continuing to do what you're already doing. You've probably done a lot of things right to get to this point. I think, the other thing to keep in mind is sometimes patients prefer to stay on low-dose metformin because it's almost like they know that then the diabetes is not going to get worse. So sometimes it can be a little bit of a safety net. But if you've been off the medication for 2 years, I would say just check your A1C every 6 months and see how it goes. And if your A1C starts to go up, then you could consider the metformin again. And also make sure you keep your weight, stable, or even keep working towards weight loss. Working.
That's fantastic. Terry says, thank you, Dr. Khan. So thank you. And yes, I know Autumn has worked very hard on her weight. So that's something that I know a lot of the folks in our group are very vigilant about and work very hard to do. Jane asked a question that also is a very common question. She says, if you always have high numbers in the morning, and she puts in parentheses 150 to 180, can you take one metformin at dinner time? Would that help?
Well, if you're already on the maximum dose of metformin, that would not help. But metformin is a very good medication for improving your morning glucose reading. So the way metformin works is it suppresses the nighttime glucose production. So as you sleep through the night, the liver just releases glucose, and that's why you wake up with high glucose readings. So metformin is very effective for that. So I would say if you are not on the maximum dose, which for me, my patients, I recommend 1,000 milligrams twice a day is the maximum dose. If you're already on that dose, then no, I would not recommend adding another tablet. But if you're not on that dose, then yes, you can increase that dose. Sometimes patients have high morning blood sugars and the rest of the day is fine. And the numbers are really good the rest of the day. And they're always struggling with these high numbers in the morning. So sometimes we have to give medication specifically to target that morning glucose, like metformin or even insulin. Works really well.
So I'm actually so glad you brought that up. And if someone watching at home is someone who struggles with morning numbers, definitely do talk to your doctor about what your options are for figuring that out. Dr. Khan, let's take a step back. Speaking of doctors, we all know that time with our doctor is super valuable, but it often goes so quickly. What are a couple of simple suggestions that our viewers at home could use to make the most of their next appointment with their doctor? What do you wish patients knew about time with you?
Well, your doctors want to take really good care of you and spend a lot of time with you. And sometimes it does feel like that time is limited and we wish that we had more time and patients wish they had more time. So I think, making sure that you get your questions addressed at the visit. And one of the ways you can do that is to just write down your questions and bring them up at the beginning of the visit. So your doctor knows exactly, what kind of questions you have. Sometimes at the end of the visit, you might feel rushed and you may feel reluctant to ask those questions. So ask them up front. The other thing is that if you bring your glucose readings to the visit, or you bring your glucose logbook or a glucose meter that we can download, for example, that's really helpful because then we can actually look at the glucose with you. We can look at the trends with you. And similarly, if you can do your A1C and your cholesterol levels and your blood test before your visit, it's not always possible, but if you can, you'll get more out of the visit. Because, even for us, it's nice if patients have that information because then it's a face-to-face discussion rather than you doctor, you get your blood work the next day, and then you get a call on the phone about your results. So it's much more satisfying for the patients and for their physicians too, if you can actually have a discussion about all of these things at the visit.
Oh, I think that's fantastic. We have several folks saying how much they appreciate hearing from you. Helen and Elvia say how much they appreciate you sharing your perspective with them and with all of us. And I guess that actually leads to one of my last questions here. How would someone with type 2 know that seeing an endocrinologist or getting referred to an endocrinologist would be the right next step for them?
Well, first of all, I would say that the majority of primary care physicians, I feel they do an excellent job taking care of diabetes. Diabetes is so and it seems everywhere you look, there's diabetes and more people are being diagnosed. So the primary care doctors are really the first line of physicians who are treating diabetes. And I think they do a really great job. But sometimes if the A1C is not responding, if you're struggling with, side effects from a medication, or you just can't seem to bring that A1C down, then that might be a good time where you can be referred to, an endocrinologist. And sometimes we are a little more comfortable with some of the newer medications that are out there. And also I would say, as a final note, that there are a lot of exciting technologies now available for diabetes, such as continuous glucose monitors, so that you don't have to prick your finger. And that's a huge advancement. And even insulin pumps for patients with type 1 diabetes or even with type 2 diabetes. So a lot of times endocrinologists are very comfortable with continuous glucose monitors and insulin pumps. So, if you are interested in those technologies, you could certainly see an endocrinologist. But I think for the most part, for mild diabetes, your primary care doctor is a great choice.
Oh, I think that's a great answer. And I want to put in a quick plug here. If seeing an endocrinologist may not be the right fit for you, it's always a good idea to try to see a diabetes educator if your insurance will allow that. They can really help you triage some lifestyle issues, maybe develop a meal plan that's personalized for you. So if you're working on those foundational things that Dr. Khan referred to earlier, an educator is also another great suggestion.
That's absolutely right. And, we rely on our educators heavily. So our nurses, our dietitians, diabetes is complex and it requires a comprehensive approach. So your doctor is just one part of it. You're a big part of it. The dietitian's a big part of it. I often will refer to an exercise physiologist to come up with an exercise plan. So, the more people you can talk to about the diabetes, the better off.
Absolutely. It takes a village. So for those of you who answered our trivia question, the answer is B, 2,000 gallons of blood every day. That's a lot of work your heart does, and all the more reason to take good care of it so it can keep doing that hard work for you. Dr. Khan, we've already passed 30 minutes. I can't believe how quickly this has gone by. It's been an amazing conversation, and I cannot thank you enough for sharing your time with us and answering so many questions from our viewers. So thank you, and I hope you'll be able to join us again soon.
Thank you. You're welcome. My pleasure. My pleasure.
Wonderful. So folks, if you think of a question that you didn't get to ask, write it down and save it for our next episode with Dr. Khan. We can't wait to have her back and get to talk more about taking care of people with type 2 diabetes. Diabetes Primetime will be back to you next month. We're actually going to do 2 episodes in a row. We're going to be talking with Shelby, an amazing woman with diabetes who's just written a diabetes cookbook that features the Instant Pot. We got a sneak preview of that cookbook, and I have to say it looks amazing. So that will be on Monday, March 18th. And then the very next night, we're going to be talking with a diabetes educator who helps cyclists with diabetes compete and win international competitions. And she will be answering all of your questions about exercise. So 2 great shows, 2 nights in a row, Monday, March 18th and Tuesday, March 19th, both at 8 p.m. We'll have more trivia questions, more great giveaways, so mark your calendars, and we hope you'll be able to join us then. Until then, take good care of yourself, and we'll see you soon. Good night.